If you're trying to decide between a plastic surgeon or a dermatologist to get your mole removed on your face, or just wondering how the whole process would look like, that was me a month ago, and here's what I've learned. Hi, welcome to my channel. My name is Erica, and I kind of just record different parts of my life, different experiences, tips, education, just whatever ideas I come up with. So thank you for watching. So disclaimer, this is not me trying to recommend or suggest or give any medical advice for mole removal, just my experience having it done and what I learned from it. So kind of for background, I had a mole removed right here. You can kind of still see, which we'll talk about later, but right above my upper lip on the left side. I wasn't born with it, but it did kind of start appearing when I was like 5 or 6, so very young, so I didn't know anything but it. And it was kind of small, like just like a small speck, like a quarter or fifth inch one. Wasn't lifted when I first had it, and then over the years, like middle school to high school, I noticed it did get a little bigger. It was still symmetrical, it was like a little bit raised, and I kind of got bullied for it in school. Not really that much like where it hurt my confidence or anything like that, but I would get told like, oh, look at that chocolate chip on your face. Or little kids would be like, why do you have that on your face? Why do you have marker, Sharpie? And just variations of that. So that was fun because it just felt awkward. Like, I don't know what else I would say. And it just shows like kids or people really notice the things that stand out. So, but I never felt ugly with it, but it was kind of just like a very big focal point on my face, and it kind of made me uncomfortable sometimes, only because when I would talk to people, they would kind of look at it, and I noticed like they would like talk to me, and then they'd go down and look, and then look back up, and I can just see like the track of their eyes moving, and it just made me feel like they were just gonna focus on that. And sometimes people would like, they would fixate on it because it was like a big dark spot on my face. To get back to it, the why now of why I ended up removing it, I don't know. I just started thinking about it more. I feel like as I grew up, maybe I interacted with more new people. I noticed a lot of people kind of looking at it, and then I noticed it in my face, noticed in the pictures. Because before that, it blended in. Like, I wouldn't know anything differently. Just like my family or close friends wouldn't even like look at it again. But I noticed that, and I just kind of thought like, oh, what if I removed it? I don't know. So then I would start covering it with like a bandage just to kind of see how it looked in the mirror or in like pictures. And I liked it. I thought it looked nicer. I didn't want like such a focus on my face. And so I was like, okay, I'll get it done. The second step was researching. And that's where I learned that it's a dermatologist or a plastic surgeon, either route. I wanted to go with the dermatologist just to see if it's cancerous, like is there anything wrong with it? And so I went to a dermatologist, and basically when I got there, like the woman who checked me in was like, "Oh yeah, you can get it removed. We can do that today." And she left the room, and she was like, "Oh, the doctor will be here." So I was like, "Oh crap." Like then I started like texting my fiance, and I was like, "Oh my gosh, should I get it done?" Like I didn't know it was going to be so sudden. Like I have to decide now. And I think towards the end, before the doctor came in, I think I was going to say no because I didn't want it to be so sudden. Or maybe I was going to say yes. See, I don't even know. And she came in, she looked at it, she's like, nope, we can't shave it here because it could have scarring. It is very lifted. So they just didn't think they could do it there without leaving no scarring or very little scarring. So then they recommended me to a plastic surgeon. And one that freaking cost was like $300 for the 5-minute meeting of them being like, nope, we can't do it. Like, great. Like, maybe they should put that online because it really says like all mole removals. But because it was on my face, they don't want to do it. If it was on any other body part, they would have said yes. Excuse the kittens. I have new baby kittens and they're very playful. Yeah, so then I didn't go to the plastic surgeon they recommended. I think I was like really Googling online, looking at reviews, and I ended up going with Westlake Plastic Surgery, like in West Austin instead. And with plastic surgery, the reason I went dermatologist route is some of it is covered with insurance, but plastic surgery is 99% of the time not, or maybe it is depending on like the procedure. But mine wasn't, so I got an appointment, and I wanted to go somewhere where I didn't have to go inside, get a consultation, then go a next day for an appointment. So it would have been like, an extra few hundred for just the consultation to tell them, yes, we can do this. So Westlake Plastic Surgery, I was able to send a picture, kind of talk through email, and they're like, okay, yes, we can do this, and it's this much, which I'll get onto later on. So I went with the dermatologist, kind of by choice, I guess, because I could have went to other dermatologists and maybe they would have done it, but I guess it was like highly recommended because they don't want people to have scarring on their face, and plastic surgeons are like, they just know how to leave a little scarring. I'll go ahead and say the cost before I talk about the procedure, just because it's less words. Basically, it cost $750 flat to get my mole removed, which is a lot because it's just like a tiny mole, but I'd rather not have a lot of scarring, which I'll show you later what like the results were. But $750, just that. You don't leave any tip. The processing fees, I feel like it was only a few dollars, not more than that. And that was it for the procedure. It's just a typical Tuesday evening, I think, or afternoon. I drive to Westlake Plastic Surgery. I go inside and I wait maybe 5 minutes. I check in, wait 5 minutes, and then they take me to their room. The lady was very nice. She told me the process of it because I kind of didn't know. And I guess before I go with the story, I'll insert clips here of me kind of recording myself getting there. Okay, so I'm almost there. So basically the process is going to be that they're going to shave it and then they're going to cauterize it to like seal it basically so it doesn't just bleed a lot. I thought they were going to extract it like from the roots because it does look like a bigger one, and I wasn't born with it, so it kind of grew over time. It is cute. I do like it. I do feel like it like complements my face, but I don't know. I'm ready for a change and to get it removed, for it to not get bigger, and yeah. I'm in the room. The surgeon's about to come in, check on it, make sure it's all good to go. Then the other lady's gonna come in and numb it. I'm scared of that part because I know that's like the worst. And then after that, he's gonna shave it and cauterize it. She said the whole process should take like 20 minutes from her like numbing it to him like finishing it all up. So we'll see. So I get there, they take me to the room. Once I'm in the room, she kind of tells me what's going to go on. So basically the steps is they're going to numb the mole area around there, like the nerves. So I'm not in pain when they're shaving it off. And I was like, okay, cool. And then after that, after they numb it, they're going to test it with needles and like tapping it. And if I'm good to go, then the surgeon's going to come in and he's going to just get a knife and shave it right off. And then after he shaves it off, he's going to cauterize it, which is like kind of burning of the skin so that it can seal it. So how that happened for me is the numbing, I would say it's like a 7 out of 10. It's kind of just like needles, like if you're getting your blood taken out. And I hate needles, but it's just uncomfortable, but it didn't really hurt. She maybe put in like, I don't know, 5 or 6, made sure it was numb. Like I think I got an extra one because I was like, I can slightly feel it. And then she actually gave me a face mask before she did that because I was scared of seeing the needle. So very kind of them. And then after that, plastic surgeon came in and he talked to me. Super confident guy. Like I see why people go there because I could trust him with anything too. I was like, oh my gosh, he just radiated confidence. Like he knew what he was doing. He knew his self. I get my headband on and he just starts going. He was like, all right, I'm about to go. And he has this knife. And I mean, all I feel is like, it's just like rubbing like this. And like, you can feel like it's like removing something, but you can't feel anything. And so then I was just like in the moment, I was like, oh my gosh, it's literally slicing my mole off and I can't feel anything. I don't know if it's like bleeding a lot. And then I swear it was like 10 seconds later, he's like, all right, I'm done. And he was like, all right, hold your nose. And because of the cauterizing, it like smells. And so I was like, okay. And then he counted me off. He used the like cauterizing machine and I could kind of smell it and kind of see a little bit of like the smoky feeling. But other than that, he had me breathe, and then I had to stop or like hold my breath again so he can make sure and seal it all up. And then that was it. He said, thank you very much. Have a great day, basically. And then left. And then the girl, she put bandages on it to cover it up. So I didn't even know how it looked like right after. And then she told me how to take care of it. So to take care of it after getting it done, you basically just have to kind of keep it moisturized. So using Aquaphor a little bit for like, I guess like the first 14 days to make sure the scab doesn't dry too much, so that it falls off. Anyways, after that, I paid and left and just went home, and that was that. I left the bandage on until the end of the night, took it off, kind of looked at it, and it was like crispy looking because it had like the burnt kind of darkness of it. And I put Aquaphor on it for 2 weeks as stated to keep it kind of moist. And for me, I would like put the Aquaphor and then I'd put like a little band-aid on it, like a little circle band-aid, just so that it was protected. And they told me not to go out in the sun without sunscreen because it could cause scarring. So I had to do a lot of that because some of my job, I do go outside, like one of my part-time jobs. So yeah, that was really it. And I kind of taken care of it since. Sometimes I put Aquaphor, sometimes I put the Band-Aid. I think it was like maybe 3 or 4 weeks in, she recommended I put like these, I don't remember what they're called, but they're like the sticky things that have like moisture inside to prevent scarring. I use that a lot kind of as my sunscreen. I would put sunscreen on, but then I would put that on if I was going out somewhere with the sun. I will say that's the only tricky part is sometimes I would want to go swimming and I'd have to kind of wear a hat or put that like sticky on, and it's not always the cutest looking thing on your face just because I didn't want scarring. So I'll go ahead and show you how it looks, the recovery of it. So if you look at my face up close and personal, you can see it's still kind of there. It's still a mole, but it's like it's flat. It's like no raisedness at all. And some of it kind of looks like it's like scarring that's healing, and a little bit like on the outer edge kind of looks like it's like the mole and it didn't remove like all of the pigment. So they said that if it comes back or like pigment doesn't get removed, that I can go like complimentary because they'll just like re-scalpel it or whatever. So yeah, I mean, I'm very happy, and if this ends up being like the scarring of it, even though it's only been like 2 months now, then I would be okay with it because it just fits my face better, I think. Like, it's not so bold or stands out. Like, it's just kind of like a sly little cute beauty mark. I think so myself. So thank you for watching my video. If you have any questions about it, you're unsure if you want to get a mole removed on your face or anywhere else on your body, I just want to say I highly recommend, if something has been affecting you or giving you negative confidence within yourself and you are capable of affording the removal process, I say go for it. Like, honestly, in the videos you saw, like, I felt a little bit of distress after getting it because I was like, oh my gosh, that was my identity, like that was a part of me. And just like that, it's gone. My like upper lip is numb. It feels like I lost a piece of me, and it's kind of sad, like I'm grieving it right now. But after getting it done, I got very comfortable and used to it, and it feels like as if I never even had it there anymore, even though I still kind of have it. So bye.